Healthcare exists for one of the most important reasons in society: protecting human life. But behind every hospital building, every medical procedure, and every healthcare bill, there is another powerful system that most people rarely think about: a massive financial ecosystem. Hospitals are not only places where doctors treat patients, they are also complex organizations managing billions of dollars, expensive technology, thousands of employees, insurance relationships, government regulations, investments, and constant financial pressure. To understand why healthcare costs continue to rise, you have to look beyond medicine. You have to understand the business behind the system. Because healthcare is not only about treating illness, it is also about economics, incentives, investment, risk management, and the movement of money. Every year, billions of people interact with healthcare systems around the world. They visit hospitals for emergencies, surgeries, medical tests, preventive care, and long-term treatments. But many people never stop to ask one important question: how does the healthcare industry actually make money? Why can the same medical procedure have completely different prices depending on where it happens? Why do hospitals invest billions into technology, expansion, and specialized services? Why does healthcare continue to grow, even when costs become one of the biggest financial challenges facing individuals and governments? The answer is found in the unique financial structure of healthcare, a system where human needs, technology, business strategy, and economic incentives all come together. A hospital is one of the most expensive organizations to operate. Unlike many businesses, hospitals cannot simply reduce operations when demand decreases. An emergency department must remain open 24 hours a day. Critical care units must always be ready. Medical equipment must be maintained. Doctors, nurses, technicians, and support staff must be available. Buildings must be powered, cleaned, secured, and constantly upgraded. Technology systems must be protected and updated. Research departments must continue developing new solutions. All of these create enormous operating expenses. Before a hospital treats a single patient, it already carries significant financial obligations. This is known as a high fixed cost business model. Fixed costs are expenses that exist regardless of how many customers a company serves. For hospitals, these include buildings, medical equipment, technology infrastructure, employee salaries, and regulatory requirements. A hospital may spend millions of dollars simply maintaining the ability to provide care. A modern hospital is not just a building with medical rooms. It is a combination of a healthcare facility, technology center, research institution, and financial operation. Advanced imaging machines, robotic surgery systems, laboratories, electronic health records, and digital healthcare platforms all require massive investment. This is why healthcare costs cannot be measured only by looking at the price of a single medicine or procedure. A medical bill represents the entire system required to deliver that service. Another major factor behind healthcare economics is capital investment. Hospitals constantly need to invest in expansion and modernization. They build new facilities, purchase advanced equipment, upgrade digital systems, train specialized employees, develop new departments. These investments are necessary because medicine is constantly evolving. A hospital that fails to invest in technology can quickly fall behind competitors. However, large investments also create financial pressure. Hospitals must find ways to generate enough revenue to cover these expenses, while continuing to provide quality care. This creates a difficult balance between financial sustainability and public responsibility. Healthcare organizations must operate efficiently while dealing with one of the most unpredictable markets in existence: human health. One of the biggest differences between healthcare and other industries is pricing. In most businesses, customers know the price before making a purchase. Before buying a phone, a vehicle, or a computer, consumers can compare prices and decide. Healthcare works differently. Medical pricing is often complicated because multiple organizations are involved in one transaction. A hospital may have one listed price, An insurance company may negotiate another payment amount. Government healthcare programs may have their own reimbursement systems. Patients may pay different amounts depending on their insurance plan, location, and type of treatment. This creates a marketplace where the original price and the final payment can be completely different. From an economic perspective, healthcare has limited price transparency. When consumers cannot easily compare prices, competition becomes more difficult. In many industries, competition pushes companies to lower prices and improve services. Healthcare has some competition, but it operates under unique conditions because decisions are often made during stressful and urgent situations. When someone needs emergency medical care, the first concern is usually survival and recovery, not comparing prices. This changes the traditional relationship between buyers and sellers. Insurance plays one of the biggest roles in healthcare economics. The purpose of insurance is to manage financial risk. A serious accident, emergency surgery, or major illness can create expenses that most individuals cannot afford alone. Insurance spreads this risk across a large population. Millions of people contribute money into a system designed to provide financial protection when healthcare expenses become too large. This is similar to how many financial systems work. Risk is distributed among a group instead of being carried by one individual. However, insurance also changes the way money moves through healthcare. The relationship is no longer simply between a doctor and a patient. Instead, healthcare becomes a network involving hospitals, insurance companies, billing organizations, pharmaceutical companies, technology providers, and government agencies. Each organization has a purpose, but every additional layer creates more complexity, and complexity often creates additional administrative costs. This is one reason healthcare can be difficult for ordinary people to understand. The money does not move through a simple path. It moves through a large financial ecosystem with many different participants. Another important part of healthcare economics is the role of intermediaries. Between the patient receiving treatment and the final payment, there may be several organizations involved. Insurance companies manage financial risk. Medical billing companies process claims. Pharmacy benefit managers negotiate medication pricing. Administrative teams handle documentation, compliance, and regulations. Healthcare technology companies provide digital systems. Consulting firms help organizations improve operations. These organizations exist because healthcare requires coordination. A healthcare system without organization would struggle to function. However, the presence of many intermediaries creates an ongoing debate. How much complexity is necessary, and how much complexity increases costs? This question has become one of the biggest discussions in healthcare economics. The challenge is finding a balance between efficiency, safety, accuracy, and affordability. Because healthcare is not like most industries. A mistake in healthcare is not only a financial problem, it can directly affect human lives. Another major factor shaping healthcare economics is the growth of chronic conditions. Many modern health challenges require ongoing management rather than a single treatment. Conditions such as diabetes, heart disease, and other long-term illnesses often require continuous care. This includes regular appointments, medication, testing, monitoring, and specialist visits. From a business perspective, recurring care creates predictable revenue. Many industries operate using recurring revenue models. Technology companies use subscriptions. Streaming companies use memberships. Software companies use monthly payments. Healthcare also contains recurring financial patterns through long-term patient management. However, this does not mean healthcare providers want people to remain unhealthy. Many chronic conditions are complex and require continuous medical attention. The economic lesson is about understanding incentives. Businesses often create systems around predictable demand. Healthcare operates within that same economic reality. Behind hospitals is another powerful part of the healthcare economy, the pharmaceutical industry. Developing a new medicine requires years of research, testing, investment, and regulatory approval. Companies spend billions searching for treatments that may or may not succeed. many potential drugs fail before reaching the market. Because pharmaceutical research involves significant financial risk, companies rely on patents and intellectual property protection. These protections allow companies to recover research costs and continue investing in future discoveries. This system has produced some of the most important medical breakthroughs in history. Vaccines, advanced treatments, and life-saving medications have transformed human health. However, pharmaceutical pricing has also created debates about affordability and access. The challenge is finding the right balance between rewarding innovation and ensuring that important treatments remain available to the people who need them. The healthcare industry is also becoming one of the biggest areas of technological investment. Artificial intelligence is helping analyze medical information. Robotics is transforming surgery. Telemedicine is changing how patients access healthcare. Digital health platforms are creating new ways to monitor and manage health. Data has become one of the most valuable resources in modern healthcare. Companies are investing heavily in technology because better information can improve efficiency, reduce waste, and create better outcomes. Investors around the world are watching healthcare because it combines several powerful trends: a growing global population, an aging population, increasing demand for medical services, rapid technological advancement, and the continuous need for better healthcare solutions. The future of healthcare will not only depend on doctors and scientists, it will also depend on entrepreneurs, investors, engineers, and financial experts who can build better systems. Healthcare is one of humanity's greatest achievements. It saves lives, creates innovation, and supports millions of professionals around the world. But understanding healthcare also requires understanding the financial system behind it. Hospitals are not simply buildings where treatment happens. They are complex organizations managing costs, investments, revenue, technology, and risk. The more people understand how healthcare economics works, the better they can make informed decisions and understand the forces shaping one of the world's largest industries. Because every major industry has a financial structure, and understanding that structure gives people knowledge, awareness, and power. If you found this documentary valuable, make sure to like this video, subscribe to the channel, and turn on notifications so you never miss new update.